This segment is sponsored by Bristol Myers Squibb and Johnson & Johnson. Clinical trials are essential to advancing medical science, but historically women, especially women of color, have been underrepresented in cardiovascular research more specifically. It is essential to have diverse representation in cardiovascular trials to ensure heart disease is accurately understood and effectively treated. Today we're speaking with Dr. Roxana Moran from Mount Sinai Health System, who will tell us more about the Librexia program. So, doctor, what are clinical trials and why are they important specifically for women and people of color?
Well, clinical trials, as you said, are the way we answer questions about safety and effectiveness of devices and drugs and treatment modalities, not necessarily devices and drugs, and any question we might have in scientific investigation. And so it's really, really important that we set those straight and that we include patients that we're going to be treated with those conditions. So obviously they have to be inclusive. Unfortunately, over the last decades, no matter how hard we've tried, we have underrepresentation of women and people of color, and especially when we know that cardiovascular disease is disproportionately affecting women and people of color. And we need to absolutely make sure that our trials are inclusive of all patients, of all walks of life, with all backgrounds. And so, of course, very important that we have women well represented. So you asked about the Librexia program. This is a program that is looking at 3 conditions, very, very important, contributing to cardiovascular disease, the #1 killer of men and women across the globe. These 3 conditions include atrial fibrillation, which is an abnormal heart rhythm, stroke, which is, of course, all of you know what a stroke is. It's devastating. And of course, a heart attack, another devastating condition. All of these 3 conditions have very important implications in increasing the burden of cardiovascular disease. And the Librexia program is looking at a novel drug to hopefully and potentially reduce that burden by reducing cardiovascular death, stroke, or MI. Potentially. We don't know. That's why we need a clinical trial to answer that question. And so what we need to do is to be sure that at the end of the day, we have answers for all patients. So the trial needs to be inclusive of women and people of color if they qualify. And so that is why we're spreading this message across the United States to make sure that you get information about these trials. And if you qualify to come in after you receive information and feel comfortable to be part of the clinical study.
Absolutely, Dr. Moran. So where can viewers go to get more information on the clinical trials and just more information about this in a whole?
Yeah, we made it quite easy. There's a website set up called researchincludesme.com. researchincludesme.com. It's a simple place to go, and you'll get a lot of information of why diversity matters. I hope you already feel that way, and that where you can go to get more information, especially if you have any of these 3 conditions that you might qualify for the study. I think knowledge is an incredible thing. It's important to know about these things and be inquisitive about that, and be great to have more women, more people of color in all of our clinical studies if we're going to improve human health.
I agree. Thank you so much, and we hope you have a great day.
Thank you so much for including this very important topic in your program.
Absolutely.
Thanks for watching. Stick around by subscribing today and don't miss a single video.